Hello and welcome. You're watching COVID 360. I'm Sneha Murdani. Well, this week has seen several states open up schools. Worldwide, there has been a debate on whether this is the right time to allow children to go back to schools, even as there are many more uncertainties around this infection. In the United States, for example, school infections have been reported as several states are now once again battling a surge in infections. In this episode of COVID 360, we tell you all about opening up of schools. How are states really doing it? And why is opening of schools still being opposed? I also spoke to Dr. Randeep Guleria and Dr. Naresh Trihan, both of them having opposing views on opening up of schools. Those interviews also on the show. First up, a ground report on opening up of schools across the country. Take a look at how children are finally getting back to a normal routine.
Students in a Delhi school receive a warm welcome after 17 months. Their teachers welcome them with a song and dance. Classes 9th to 12th will now function with 50% capacity in the national capital. The day started with yoga sessions and prayers before the classes began.
Now it's time to attend classes. After all, they have missed their friends, their classroom, their teachers, and after really long, they are entering their classroom. And that is the sense of excitement among the kids. But first, it is the duty of the teachers, principal, and the school administration to ensure there is a COVID protocols followed in all the classrooms.
As classrooms got a new life, the excitement behind the masks could barely be hidden. Most students are happy to be back in school and to meet their peers after a long wait.
I'm very happy that at last we are attending the offline classes, and with all the precautions we are coming, so there is less fear of COVID.
स्कूल को बहुत ज़्यादा मिस किया और पहला दिन अच्छा लग रहा है, पर बारिश की वजह से थोड़ी प्रॉब्लम्स हुई आने में.
For many children, the reopening is a necessity. Aradhana, a student in a Delhi government school, tells us that her family had only one mobile phone that barely helped her attend online classes. She can now resume her education without interruption.
बहुत अच्छा लग रहा है सबसे मिलके, सबको बहुत मिस किया मैंने. हमारे घर में एक ही फ़ोन है, वो भी मम्मा का है, और हम लोग पढ़ने के लिए 3 हैं, तो हम लोगों को बहुत परेशानी होती थी. अगर एक को पढ़ना है तो 2 को अपनी क्लास छोड़नी ही पड़ेगी.
But many parents are still wary. They are not ready yet to give their consent for classes.
Fear is that बच्चों को कहीं catch ना.
Ma'am, of course there is a fear, there is a third wave fear and everything. So of course we cannot take the risk at all. It's very good that they have given us 2 options. One is offline and one is online. Correct. And we are very much satisfied they have given the online.
School reopened in 5 states and 2 union territories on Wednesday. While a vaccine for children is yet to be approved, medical experts are supporting the reopening of schools so long as COVID-appropriate behavior is followed.
Considering the possibility of the spread and the risk, it is the risk is quite negligible at this moment, unless something very catastrophic events taking place. Otherwise, I think it is a safe move. It is the right time the government should come forward and take the calculated risk and open the school in an appropriate way.
Syllabus revised, friendship revived, and this time in person, face to face. Today was a test day for Delhi government schools, and despite the heavy downpour, many students did return to their classrooms, primarily because online education is still a privilege, because they do not want their education to be interrupted anymore. With Sachin Chandok, Pooja Shali for India Today.
Well, here's an excerpt of a conversation I had earlier with Dr. Randeep Guleria on opening up of schools. He was amongst the first few experts who had suggested that India must open up schools and take precautions, of course. Dr. Randeep Guleria, thank you for your time here. I want to begin by asking you how schools, in fact, are opening up across the country. What exactly is the word of caution given the concerns around the surge in infections in several parts of India?
So first of all, I think schools need to open up at some point in time, because when we look at education for children, it's not only the online classes, it's a lot of physical interaction, which is important, whether it be with teachers, whether it be with their other friends and other activities. And many children get left out of these activities if they don't have internet connection or are not having a smartphone or a computer at home. So it's important to have schools physically present. But when we open schools, we also need to be cautious. We don't want children to get ill. So I think the first thing is that we need to make sure that in areas where schools are opening up, the case positivity is very low. We know that for many weeks now, we have very few cases in Delhi. So in a situation like that, when your case positivity is very low, it would be practical to open schools, because if you look at the risk-benefit analysis, the benefit is much more than the minimal risk that may be there of schools opening up. But along with that, the school authorities need to also have certain things in place. All the teachers and these other people working in the school, the older people should get themselves vaccinated. So the school should have a vaccinated staff. Along with that, there has to be some degree of COVID appropriate behavior and mechanism that children don't get crowded together, so that especially during the beginning of the school and the end of the school, and when there is the lunch break. So that has to be staggered to some extent so that crowding doesn't happen. And there should be good means for hand washing. And if ventilation is possible, then good ventilation in the school would also be something that would be very useful.
What about Covaxin for children? When is that vaccine expected to be rolled out?
I'm hopeful that, and this is based on my own opinion, that it should come through even earlier. But like I said, this depends on how the data analysis is done and when the company applies for regulatory approval.
Are we seeing the third wave in Kerala?
So the situation in Kerala is a little bit of a worrisome situation, because the cases are not coming down. They're showing a rising trend. And that is why there is a concern that could that be the nidus of the beginning of cases coming to other parts of the country. And that is why very aggressive action is needed to make sure that we bring down the cases in that state by doing a lot of containment strategies, testing, tracing, treating, and isolation, and make sure that we are able to bring down the cases, because that could lead to cases increasing in other parts of the country. Whether that may lead to another wave, that's difficult to say. But I think the whatever data we have suggests that because seropositivity in the population is high, good amount of antibodies is there, our vaccine drive is doing well. Even if we have a surge of cases, I think it will not be that bad, and it will probably not be linked to too much to increase hospitalization or deaths. We may see more infections, but not see that type of hospitalization that we saw in the second wave.
When is Covaxin likely to get an approval from the World Health Organization?
So I think that has also been submitted to the WHO. The documents that they wanted have also been submitted to them. So let's see. One is hopeful that by in this month you may get the WHO approval, but it's difficult for me to say. This is something which the WHO committee has to take a call on based on the data that has been given to them. One is hopeful, and would like that it gets approved as early as possible, because many of us who have taken Covaxin would want the WHO approval, because that will help us to really travel with the certificate that we have got a vaccine which is WHO approved.
What is the thought behind booster doses, and what is the government of India planning right now when it comes to booster doses?
So I can give you my personal opinion. In my personal opinion, I don't think there is a need for a booster dose right now. We don't have enough data to suggest that a booster dose is required. Even if you look at what we call antibodies level, we don't know what is the antibody level which gives you enough protection. And we don't know what is the degree of cell-mediated immunity which is required. Therefore, just to say that because you've had infection many months ago, you should now take a booster dose, there is no scientific evidence to really support that. So I don't think there is enough evidence currently to really say that we need to have a booster dose. Secondly, I don't think that we even know what booster dose is the best for a given individual. Should it be the same vaccine? Should it be a mix and match? Will we get a better booster response if we say if I had Covaxin and now we take Covishield, or we take an mRNA vaccine? We don't know what should be the ideal booster type of vaccine in terms of platform. And I would also say that if we have to get rid of this pandemic, we have to first focus on everyone getting vaccinated. If countries give a booster dose and other countries are not even able to give one dose to their population, then the pandemic will continue and the virus will mutate in the future, where even the booster dose efficacy will come down. Therefore, I think we should focus more on trying to vaccinate as many people as we can globally to really prevent the virus from multiplying more and saving people's life by causing less severe disease.
I spoke earlier to Dr. Naresh Trihan, top doctor in India, who says that this is not the time to open up schools. He's wary looking at the situation in the United States of America. Take a look. Dr. Trihan, you have in fact indicated that you're not too happy about schools opening right now. Just to tell us, what are the reasons and what are your apprehensions around opening up of schools, even with COVID appropriate behavior, even when protocol is followed?
See, there are several aspects to consider. One, the fact that are all the teachers and the staff of all the schools vaccinated which are going to open? Because if you look at it, that a lot of the teachers probably are below 45 years of age, and have they gotten their second dose or not? Because the basic thing that is coming out is that the Delta virus is the immunity that these current vaccines offer is in one dose is not adequate. It's about 35, 40, 45%. And the protocols are that all the staff has been vaccinated. Children will wear a mask all the time. There will be airing of the whole area in a way that there is no possibility of the virus circulating inside a given area where the students are. The third thing is the fact that children, have this tendency to not be so cautious and maybe mix with each other a lot. If you look at the US data, the schools opened around after 4th of July, which is their holiday season. In the middle of July, there was, in a week's statistics, 38,000 children got COVID. If you take it in August, the same period for 1 week, it is 138. So it jumped more than threefolds because of the school mixing, and the children showed very high level of positivity. We don't have the medical facilities. If children en masse get the virus, they need hospitalization. We are not prepared yet to have enough facilities for children because of the fact that you need specialized ventilators, specialized equipment for everything, specialized medicines, microdosing, and also there is a paucity of pediatricians who know how to treat children. So I am in favor of waiting till the vaccine is around the corner now. So we have waited 18 plus months now. Then can we wait for another 2-3 months? And there's a lot of festivities coming up also, because they see what happened last year. Last year, at this time, the numbers were very low. But as the festivities started, the numbers started rising.
But doctors, including researchers from AIIMS who have in fact concluded a study, do seem to suggest that the third wave is not going to have any sort of a severe impact on children, and that they're not particularly vulnerable, given the fact that if you just look at the seroprevalence, they in fact have also had fair amount of exposure to the infection in spite of the fact that they've not gotten vaccinated, but the seroprevalence is as high as 60%. So why are you fearful then?
The question mark here is the seropositivity was to which one? Was it to alpha? Is it to delta? Or is it going to be enough for delta plus? See, there's a lot of guesswork going on in this whole thing. Nobody knows the facts. Nobody knows the future. All I'm saying is that if you look at what's going on in the world and it had happened in the world before also, that before we got the second wave, other countries had shown that the second wave was much higher than the first wave. It's one thing for adults to be exposed and survive. It's another for children to get hurt. It will be devastating for us. So from that point of view, I am very cautious in saying, yes, go ahead with the schools. I have reservations. As I said, I would be very happy if my reservations prove out to be wrong and that everything goes very well. That will be the best for our country and the children.
Several states, including Delhi, have allowed parents to take a call on whether they want to send their children to school or not. But there are several who are not taking a chance just yet. Well, here's a report on what parents who are still choosing to keep their kids at home really coping up.
7-year-old Hiram Upadhyay's parents are apprehensive about sending him back to school. They fear he may not be able to follow COVID norms at school as he's too young to follow the guidelines.
The vaccine for the kids are still not available, so we will be more comfortable if he continues with his online classes. And when this scenario improves, we'll definitely love to send our kid to the in the school.
For now, they insist he continues his online classes. But opening up of schools is a boon for the middle and lower middle class families who found it difficult to cope up with online classes. As schools opened in Delhi, many students turned up despite heavy rains.
पानी बहुत ज़्यादा भर रखा है और हमारे जूतों तक में पानी भर रखा है और तब भी हम आए हैं
लेकिन स्कूल आने का उत्साह था
यस मैम हम पापा मना भी कर रहे थे क्यों आज स्कूल बारिश बहुत हो रही है मैम तभी हमें जाना था
हमारी मम्मी ने मना करा था कि आज बारिश हो रही है स्कूल मत जाओ तो हमने कहा नो मम्मी हमें तो स्कूल जाना कंपलसरी है कि ऑनलाइन पढ़ाई में ज़्यादा मतलब समझ में नहीं आता
The pandemic has once again exposed the stark divide in society. While the affluent prefer to wait for the vaccines, reopening of schools has proved to be a boon for children from lower income groups.
They were sitting online for months on end, but now finally offline classes have resumed and it seems like students are excited. Are you excited for school aane ke liye? Yes! Okay, so that's the kind of enthusiasm despite the fact that it's been raining heavily in Delhi and students are back to school in a safe environment, meeting their friends, meeting the teachers for their physical, mental well-being and education, most importantly, which they have missed out because of the COVID pandemic. With Alok Das in New Delhi, this is Milan Sharma reporting for India Today.
Well, there is an argument for schools to open up and there is another argument that seems to suggest that right now schools should not be opened. So what are the reasons for opening up of schools? Kids can handle infection better is what is being said by many experts. There is low risk of severe COVID among kids as per the data that is available before us. Kids have been missing out on school and hence missing out on their social life and also life skills and failing to learn all of these things that they should be learning. The digital divide is extremely for us to see. It's really in our face right now where online classes is just a luxury for a couple of children and not for most of the children. Well, there is another set of argument that says that schools now must not be opened. What are the reasons? There is a threat of a third wave. There are just too many uncertainties around the third wave and hence schools should not be open for children. There is no vaccination for children just yet in spite of one vaccine getting that approval. School safety protocol might not be followed very strictly and that then could lead to problems. Well, apart from that, distancing ventilation in classes is still a challenge. How will you ensure all of that is what many people are asking right now. A study done by the Indian Council of Medical Research tells us that one dose of Covaxin seems to be providing good protection to those who have suffered from COVID-19 in the past. Take a look. For those who have recovered from COVID, a single dose of Covaxin is equivalent to 2. A study done by the Indian Council of Medical Research has found. So how was this study really done? Blood samples were collected from 114 healthcare workers and frontline workers who received Covaxin at vaccination centers in Chennai from February to May 2021. Scientists attached with AIIMS 3 institutes found that 30 had a history of exposure to the virus while others did not. Overall, good vaccine-induced antibody responses were seen in prior SARS-CoV-2 infected individuals who received a single dose of Covaxin. Well, it was similar to antibody responses seen after a 2-dose vaccination course administered to those who had not got infection. What this effectively means is that those who have got 1 dose of Covaxin after having contracted COVID infection in the past, before May, have the same level of protection against the disease as those without prior infection. Well, if these preliminary findings are confirmed in large population studies, a single dose of Covaxin might be recommended to previously confirmed COVID-infected individuals. It would also attain the larger benefit of a limited vaccine supply. But for now, since the study is not even peer-reviewed, there is no recommendation to take 1 dose of Covaxin. That's all we could pack in this edition of COVID 360. Until next time, stay safe, be well, and do get a shot against COVID-19 if you haven't already. Thanks for watching.